Alexandria Ocasio-Cortez of New York, who is the author of the bill I mentioned, and Congresswoman Carol Miller of West Virginia. Welcome to both of you. I thank my colleagues for their testimony, and without objection, both of you are welcome to join us in the dais and participate in the remainder of this hearing. Ms. Ocasio-Cortez, welcome.
Thank you, Chairman Connolly. I'm honored to be here today on behalf of my constituents in New York's 14th Congressional District. And I want to thank you and this entire subcommittee, as well as the committee at large, for participating in and leading in this week's historic hearings to examine the status of our nation's children. I'm testifying today not only as a member of Congress, but as a former child of a family in poverty, and who has family that continues to live in poverty. I am the daughter of a domestic worker. My mother cleaned houses growing up, and I grew up doing my homework on the stairs of other people's houses and on other people's kitchen tables, and reading in other people's living rooms as my mother scrubbed toilets and swept floors to make sure that we had a better life. I'm also the daughter of a young business owner. And my dad, at the age of 29, had me and started a business at a very young age. And growing up, we struggled a lot. Right around the time things started turning up better for my family, my father was diagnosed with stage 4 lung cancer, and he passed away when I was about 18 years old. Suddenly, I was the daughter of a single mom, and growing up, trying and striving as a first-generation family to be able to be the first on my family to go to college, to work and have the distinguished honor of interning for the late Senator Kennedy in that time, and then after graduating college, returning home to the Bronx, to my community, to try to make a difference, to see that these cycles of intergenerational poverty cannot be broken unless we take deep, strong, and systemic action. Oftentimes we hear and see a lot of, I believe, unnecessary, there's a lot of unnecessary, I would say, scandal that is kicked up around the poverty line. That recognizing poverty is some secret conspiracy to expand our social safety nets, because in a time of endless war and corporate giveaways, one of the biggest mistakes we can make, I suppose, is to help people too much. But I do believe that what we need to do is actually recognize the state of poverty in the United States. The current level of the poverty line is simply being calculated by the price of minimum dietary requirements times 3. The current poverty line assumes that you have a spouse at home full-time taking care of your children. The current poverty line assumes that you don't really have any significant healthcare costs. The current poverty line does not acknowledge geographic difference, which in a time when people complain and talk about how government does not understand the regional difference between urban, suburban, and rural communities, our poverty line treats all of these communities exactly the same. All of this is wrong. And even with that drastically mistaken number, even with that, by that calculation, today, 40 million Americans live in what the government recognizes as poverty. That's 1 in 10. 18.5 million Americans live in recognized extreme poverty, and 5.3 million Americans live in recognized absolute poverty. You know, that last year I spent a very long time putting together, along with our team and with other members, and yourself included, colleagues of Congress, with the Recognizing Poverty Act. And this asks the federal government to do a simple thing, to actually measure the amount of poor people in the United States of America. We do not do that. And as a consequence, America is in a state of denial about the level of poverty in this country. As a consequence of that, we do not truly understand the actual status of where people are. So as a consequence, the Recognizing Poverty Act requires the Secretary of Health and Human Services, in collaboration with the Census Bureau and the Bureau of Labor Statistics, to work with the National Academy of Sciences to change the poverty line, adjusting for family size and geographic differences in the cost of goods and services. We must look at where our children live and what they need, because we cannot go another year with kids not getting food that they need, not losing parents because they can't afford health care. This is a moral wrong. And for children to lose their parents because they can't afford insulin or chemotherapy in what we proudly call the richest country in the world is a moral injustice and a moral outrage. Thank you very much.
Thank you so much, and thank you for your leadership on this issue. Representative Miller, welcome.